Right, good afternoon everyone. Nice to be here. My mother-in-law is a lifelong Manchester United supporter, so I can't declare any personal conflicts or interests attending Man City, except we don't get on that well, so it's lovely to be here. I'm a consultant psychiatrist with a background in sport. Because we're short on time, I'm going to be relatively quick in this, but all you need to know is that I and my team work with about 15 sports in the UK and outside of the UK, working with a range of athletes from junior level up, not that many under 18, because funding for apprentices and younger athletes is not fantastic in mental health space. We're involved in treating clinical work, but also in education work and preventative interventions as well. If this clicker will work, here's what I'm going to jump through today. Very briefly, the first section, hopefully some of you will be familiar with some of the data around mental health, and if not, maybe this is one or two things you can take away for yourselves, because the key message from me is parity. Mental health and physical well-being, mental health, physical health, mental injuries, physical injuries, parity. They should be on the same level playing field. We're a million miles away from that at the moment, but that is the goal. So, what do we know? Here's what we know. We know that 1 in 4 people in the population in the UK and civilised societies like the UK, if we can call it that at the moment in the context of Brexit, are likely to develop a mental health problem in their lifetime, 1 in 4. Hands up if you think the risk is lower for athletes, about the same, and higher. Okay, you're right, although the evidence is not that compelling as yet, but it's a really interesting area of research. We know that there is no such thing as an ultimately resilient personality. About 10% of the population are born with characteristics genetically that make them a little more optimistic, a little more open-minded, that could be protective, but no one is immune from developing mental health problems. So if you think about the populations you're working with, both in sport and outside of sport, 25% of that group have a lifetime risk of developing a diagnosable mental disorder. So that's about you chunk here in this room. So it's a real problem, it's amongst us all of the time. It's common, but the good news is the common disorders are very treatable, especially if we can tackle and intervene at an early stage. Depression and anxiety, as you've heard from other speakers, are the most common things that we see. People often ask me, what is it about people in sport or their environment that causes mental health problems? It's the same as for any people outside of sport, multifactorial. There could be some genetic loading because of genes, people in the family that have had depression in the past. It could be related to environmental factors, stress, etc. Could be related to other factors such as adverse coping strategies, misuse of drugs, alcohol, other things. Often it's a number of things that come together. But most importantly, and I think one of the reasons why you're all here, is that early intervention is the key. The sooner we intervene, the better the outcome. It's not just about those in sport. There was a fantastic study done in 2013 by the Professional Players Federation looking at football players, cricketers, rugby players and some jockeys. And what they found, perhaps not surprisingly, is that the transition out of sport is a massively difficult time for athletes. The first 2 to 3 years is incredibly difficult. I'm a former professional rugby player. I spent 10 years playing at London Wasps. The last 2 years there I was a semi-pro, so I was there through the transition. I found retiring from that level of rugby very, very difficult. I was someone who at the time was mentally well, physically very fit, and arguably as a psychiatric trainee a couple of years ago away from becoming a consultant, very, very insightful into this area, and yet my transition was difficult. My mood was affected, my self-confidence was affected. For the year after I left Wasps, I had not got the confidence to go to the club to watch them play, because in my mind, I was yesterday's news, I was history, all the young bucks had come through, and I was being left behind. Irrational thoughts in a very stable, sensible, well-educated guy who had a great job. I was already working full-time as a doctor, so there were no other risk factors there, and yet the transition was difficult. So perhaps it's not so surprising, particularly for younger players, forced out of a career through injury, unplanned retirement early, that we see these incredible stats where the incidence of mental health problems is very significant. That, of course, is why the work that the PFA, the RPA, the PCA, all the other player associations do is phenomenally important, preparing for life after sport. Very often, youngsters come into the sport and they have a sense of being invincible. I'm going to continue doing this, it's going to be a career till I'm 35. They're 18, they're injured a year later. If they've done nothing about preparing for life after sport, it becomes very hard. So that's one of the areas that we can help them with. Here's my mental health spectrum. Many of you may have seen something similar to this before, but all of us, our athletes, our players, and ourselves, all sit on this spectrum, and we move. We move up and down the spectrum. I would love to think that the majority of us in this room are sitting in the light blue and the orange zones. So we're mentally well, we're physically well, and we're flourishing. But the reality is, the pressures we work under, the pressures of working in the digital age, the kind of work that we do, mean that at times we will overwork and we will burn ourselves out. And we end up in the grey zone, where we call it languishing. And that's a technical term picked up by the term adjustment disorder. And I think Colin was referring to this earlier when he said a lot of the people that come forward to contact the PFA's network, they're not diagnosably depressed or anxious or suffer from mental disorder, but they're dealing with some emotional difficulties, and they do need that support. And it's important to pick them up there because, as I said earlier, I hope you remember this, early intervention is key. But the reality also is that with our groups, we're going to have 10%, 15%, maybe more at any one time who are suffering from symptoms of common mental disorder. They're going to impact on their behavior, on their performance, and what they're like around and to be around. So it's very, very important that we all, practitioners in sport, acknowledge that this is something that's there all the time. It's not new, it's not getting worse, rates are relatively similar, but we're getting better at picking it up and people are getting better about talking about it. So we must accept this. Why do people in sport particularly come into difficulty? I've talked about transition already, but there are a number of factors that have been shown through research to potentially contribute to the development of mental health problems. And these common stressors, if you look at them, are part and parcel of a sportsman, a sportswoman's life all of the time. So therefore, maybe it's not so surprising that research is starting to show us that the incidence of mental health problems is slightly higher in an age-matched population of sportsmen and women compared to non-sportsmen and women. Each and every one of those is, if you like, seen through the lens of the individual. And that's one of the reasons why our perception, the way in which we integrate or deal with or see stress and pressure, is a crucial factor for determining how resilient and robust we'll be. And a lot of people that end up seeing counsellors with the PFA network, psychologists that work with ourselves, psychiatrists, are helped to understand, to look into their thinking styles and the common thinking errors that they make, which actually can make stress a lot worse. This is part of cognitive behavioural therapy and related approaches. So who do we see? I said at the beginning, we don't see that many younger athletes, and that's simply down to funding. If they were equally funded, you'd see a level very similar to those who are 18 to 25. I think what this slide is showing us is that actually anyone involved in sport is vulnerable to developing mental health problems. As a 52-year-old man, I was very excited to see 51 to 55, the incidence of mental health problems is 0, so I'm happy with that. But of course, that's just artifactual. The takeaway point is that anyone of any age is susceptible to this. We shouldn't just be targeting academy players. We shouldn't just be targeting those in the lead up to transition and retirement, although they are a higher risk group. And what do we see? Primary diagnosis. The most common thing that we see is an anxiety disorder. And second to that, adjustment disorder. So that's a set of emotional responses which are changing, fluctuating, which often have anxiety as a component, sometimes have low mood as a component, but fall somewhere short of a diagnosable diagnosis of depression. The reason, as I said before, that that's an important group is that if you intervene quickly and early, you get fantastic outcomes with relatively short interventions. If you look at what the National Institute of Clinical Excellence say for the treatment of an anxiety disorder or a depressive disorder, they say somewhere between 6 and 10, 6 and 12 treatment sessions of psychological intervention will treat, will effectively improve those symptoms. If you pick someone up in an adjustment disorder phase, that number comes down to between 2 and 6. So there's a significant cost saving and a significant reduction of the burden on the individual. Okay, so that's the context we're working in. You've heard a lot already from Colin and others about what mental health support is available. In a sense here, we're talking about someone who's developed a problem, they've accepted it, or someone else has brought it to their attention, and they're on the point of getting help. Why is that important? Well, it's important because 2 reasons. We've talked about intervention for outcomes, but increasingly what we're seeing is that this issue about confidentiality is getting in the way of people seeking help at an early stage. And that's why organisations like the PFA, the PCA, the RPA, as the trade union body or the protective organisation for the players, are in the best place to confidentiality support their members. These aren't people declaring a difficulty at the club. The reality is we would love people to be accessing help in any way that they can. But at the moment, this is the sort of hierarchy that we see across the sports we work with. The most common route of referral is self-referral. And more often than not, that's associated with a conversation that that player has had with a member of the player association. So they've talked, they've disclosed, they've shared something they're concerned about, and that member of staff has said to them, ring this number. A number of players won't do that themselves, and we're in a situation where we'll be phoned up and we'll have to have a dialogue encouraging the PDM, the player development manager, to facilitate that call. Sometimes we'll phone the players themselves. And it's interesting because we've struggled over the years thinking about how proactive do we need to be with this, and the conclusion we've come to is very. Yes, there is a risk that you'll put people off, but the early intervention piece is really vitally important. So however it's going to happen, we need to capture those individuals at an early stage. Encouragingly, we're seeing far more referrals coming through now from club staff. One of the points that I think emphasises that is again around this stigma notion about who can people talk to. And if you're a hands-on physical therapist, I remember this from my days at WASPs, I would be much more likely to open up and talk to someone who's physically treating me, who I have this close bond with, about stuff that's going on at home, especially if that's a regular treatment period through an injury phase. Even if it's not serious injury and out from the game, but a regular treatment going through while someone's still playing. Much more likely to open up and share, which is why it's so important that the likes of people working in those roles are well educated in that area. How can we intervene? Top tier, mental health training should be across the board. I'll come on to talk about that. Psychological health screening, we don't have that much time to talk about it, but a number of clubs in football are now looking at a twice yearly screen using something like the PHQ-7, GAD-9, just to give a spot measure of depressive symptoms and anxiety symptoms. Will it catch everybody? Unfortunately not, because it's a self-report process, and those players, those individuals that don't want to disclose will underscore, but it will pick up some that aren't being picked up. Clinical service is what I've just been talking about. Performance coaching goes without saying, certainly in the elite level of sports, is part and parcel of what that is. Working with sports and performance psychologists to help them identify at an early stage, but also recognise the limitations of their ability. And we've had some absolute car crash cases where well-intentioned, well-meaning sports performance psychologists have tried to take on a clinical intervention and it's gone badly wrong. It's really important that you know the limit of what you're good at and know when to signpost and help other people. And finally, that middle bar, just up from the bottom, resilience training. This preventative approach, taking cognitive and behavioural skills and turning it into a coaching modality. This is something that's going like wildfire in the city. The best comparative population for young male and female sportsmen and women is the people working in professional services in the city. They get hammered, they work extremely hard, they're working to goals, they're under pressure week in, week out. And there's very good research that shows that if you can teach these people good cognitive and behavioural, third wave skills, mindfulness, etc., and help them just to shift their mindsets ever so slightly, you can minimise the impact of these damaging environments and help them to sustain their performance longer. And I think really looking at the researchers in the room, one of the big things that's missing from the discussion, the jigsaw, is how can we get some meaningful data about the impact of mental well-being on performance, individual and team sports. Because once we get that data, parity will follow very quickly. Once senior people recognise that these interventions are going to impact how your team plays week in, week out. Perhaps no surprise that Saracens, one of the most consistently successful rugby clubs in England over the last 5 years, was the first club to employ its own personal development manager, to have a number of different initiatives around well-being, helping players to be more rounded, a philosophy discussion group, all sorts of really, really out-of-the-box stuff. Perhaps there's no coincidence, but we do need the data to back that up. I mentioned getting barriers to help and how we get in early. There are a number of blockers. The biggest one for me is stigma. And just to pick up a couple of my colleagues, when we're ever talking about these issues, when we're at conferences, it's always flattering to be sat in the audience and hear people like Colin and others say, you know, I defer to the knowledge of my colleague Phil in the audience. And that's right, but let's not use that. Let's not use our relative lack of expertise as a reason to avoid something. Just think about your fight-flight response. Anything that's a threat, anything that causes us to feel uncomfortable will generate that fight-flight response. You've got two options. You can either get in there, roll your sleeves up and get on with it, or you can back away. So my advice is don't back away. Don't just think that because you aren't as knowledgeable or as trained in an area that you can't get involved. Think about all your subspeciality areas. All of you have practiced for many years and you've ended up being subspecialists in a certain area. You were generalists when you start with. There's no reason why mental health can't be something that gradually over time becomes something you're more familiar with. And those other barriers to seeking help, I mean, they're very common and they're waived a lot of the time. But really, certainly in football, we're in a situation now where the environments are set up. There is, on the whole, reasonable access to support. How do we facilitate people getting help? We're doing it today. Education, awareness raising. This stuff is vitally important. Talk about it. Talk to your friends about it. Talk to your family about it. Talk to your children about it. Talk to your peers about it. Because the more we talk about it, the less frightened we are about it, the less stressed we are, the less we avoid it. It's really, really crucial. I talked about the benefits of early intervention. Well, there they are set out, and that is a well-recognized and reputable piece of research in one of the journals. All of those things are reasons why early intervention is key and why overcoming stigma is crucial. Faster recovery, impact on performance, lower need for medication. I said to you before, if you get in early with adjustment disorders before they become an anxiety disorder or a depressive disorder, it takes less treatment sessions, which is true. But also, you're less likely to be in a situation where people have got moderate and severe depressive disorders where medication might be necessary. In the world of sport, getting individuals to take medication is usually a real challenge, even though it may well be indicated and beneficial. Save cost, improve access, and lastly, reduce stigma. And that's the one I think we all need to go off. Seen this before, so jumping on. What should you as practitioners be looking out for? I think it comes down to behaviors. I think it comes down to changes in how people are interacting. And I love the speaker before who said, you make the guys walk around and shake hands with people all the time. I love that for two reasons. The first reason is it's a really good pro-social skill in a group of adolescents who often have kind of missed out on that opportunity to develop. But as you recognize, it gives you a hand-on opportunity to have a barometer. What are they like? What's happening? Why is he avoiding eye contact? Or why is he not shaking hands with someone? I think that's fantastic. Sustained change. Any of these over a period of more than 2 weeks, you should be thinking, is there a mental health problem here? So the early things we get with anxiety are common: insomnia, worry, tension, not being quite themselves, not being as focused. Many of these things make an appearance, and we all start to think about performance issues. So the coaches are thinking, we've got to beat that guy, that girl a little bit harder because they're just not performing. And of course, that is the wrong intervention. Then we get mood-related symptoms, feeling low, fatigue. Depression's an amazing disorder. It slows us down physically. It actually slows our bodies down, our physical bodies and our minds down. That's why people sometimes say to me, that player that got so much better when they were on an antidepressant, why is that? The reason is because you're reversing some really crucial fundamental biological changes when the depression gets significantly advanced. Hopefully we pick them up well before that. We can then see real difficulties in terms of behavior. And at that point, coaches and others are thinking, right, let's get them out of here. In terms of awareness, I can think of 3 Premiership club doctors who know that if they have a player who has a mental health problem, they cannot tell the manager and the senior coaching staff because the player will be exited. They have to manage it under the radar because they've just learned that that's the culture in the club. And that's only a culture based on fear, based on avoidance, based on not knowing. So we must not accept that and try and change it over time. And so we build up, and eventually we get to a situation where individuals can cataclysmically present in a really, really, really disturbed state, sometimes completed suicide. There have been a number of very high-profile suicides, and cricket has had more than its fair share, for some interesting reasons, which research hasn't confirmed, but we seem to think that one of the problems with cricket is it's such a mobile game. You move around so much. You're away for 2 days, 3 days, 4 days, 5 days. If you're in the international squad, you've probably got no more than 80 to 100 days at home, in your own home. So as a young man, making deep, meaningful, supportive connections and relationships is much harder to do. Therefore, when the pressure's on, and don't forget, it's a team sport, but individuals compete in cricket. You're the bowler, you're the batsman, the pressure's on you. When those things come together, it can be disastrous. A couple of very informative and overly wordy slides here. Just leave them up there for you to have a quick look at what the psychological signs might be. Copies of these will be shared, so you don't need to furiously write them down. What we might see physically. and behaviourally. Sports are different contexts, different presentations, different behaviours. We do need to have an understanding, if we work across different sports, as to how the context will impact on individuals. When we first started doing this work at Cognacity, one of the things that we thought would be quite smart was to have a psychiatric assessment at the front end of all the cases we saw. For cost reasons and practical reasons, we moved away from that. Was that problematic? I don't think so. But what we do make sure we do is that we've got psychiatric oversight of every case that's live, because an individual can go and see a very experienced therapist, psychologist, counsellor, and embark on a process of treatment which is targeting what they're presenting with, but things may be lost. So it's really important to make sure there's some degree of screening, particularly around cases where risk starts to become apparent. The sorts of approaches that get used these days always involve a detailed formulation. So you go and see a clinician, more often than not it's a psychologist or a counsellor, and at the end of that first assessment session, sometimes it might take 2 sessions, that individual will have worked out and shared with that player, that athlete, exactly what their kind of formulation, their understanding of the problem is. And that enables them to then start to tackle and to focus on what some of those issues are. And I've talked before about the kind of recommended treatment modalities and lengths. And you can see that for some of these disorders, particularly eating disorders, we're talking long-term work. And the diagnosis of an eating disorder in an athlete is often a big problem, particularly if they're playing in a sport where funding is an issue. And liaising and handing over to NHS services becomes very, very difficult. I've already talked about psychological screening. So let's get on to education, because really kind of that's what we're here to do. We've done a lot of work over the years with different associations, and we've admired the fantastic work done by other organisations and associations, because when someone of high standing, who's recognised in the media because of their sporting prowess or achievement, shares their story, talks about what they've struggled with, it's a massive gateway and lowering of a barrier to others to seek help. Duncan Bell, the ex-Bath and England prop, quite a few years ago now, maybe even 6 years ago, made a disclosure at the point of retirement that he'd struggled with depression throughout his career. And he had to be coached and supported through that. He wanted to make that disclosure, but it was not easy for him. And he was bowled over by the amount of young men that contacted him directly to say, thank you so much for saying that. I'd have never believed that what I'm struggling with is what someone like you, who represents this great achievement, struggled with. And so enabling people to come forward and get help is fantastic. We don't have time to play the video, but some of the stuff that the PFA share is amazing. This is a fantastic video of Stephen Corker talking about his own difficulties, and it emphasises a point that Colin made earlier about addiction maybe just being, or addictive behaviours maybe just being a symptom of underlying problems. Quite often we're talking about multifactorial things. So in football, if you can get sharing of this information into the right places, it does make a massive, massive difference. What about educating staff? Well, I think that this is an area that really does need development. A number of the Olympic sports are now targeting a year-round programme for educating their high-performance network support staff, because these are the people that are going to be in touch with the athletes. It's very different to team sports, where you've got a whole, if you like, community working together where people share views. Olympic sports are very different. These are the sorts of things that we would look at covering, a number of which have been talked about today. And number 4 is really important, roles and responsibility and confidentiality. I think it's one of the areas where people just get, again, a little bit fearful, and they kind of rock back on their heels and they're not sure about what to do. Just remember best interest. If you're acting in someone's best interest, it's very, very difficult to sue you for negligence. If you think, what would be the best thing here? And always remember to speak to a colleague. You can speak to a colleague in confidence without naming somebody, to share that responsibility and share that thinking about what is the best way forward. So I've rushed through this to keep us on track because I've got a train to catch. and here's my summary. So mental health problems are common. 25% of us in the population. It's not you lot, it could be any of us, but we're at risk of developing them. The symptoms and signs are no different for athletes than they are from the general population, but it seems to be the case that our athletes and players are at increased risk in that age band of developing them. Early intervention is what we should be going for. Anyone can and should signpost an athlete or a player to get help. Full assessment, in my view, is really essential. It's not okay just to drop in to do a little bit of light counselling and talk about things. What presents at first light can often be just the cover of something that's much, much more deep-seated. A multi-agency approach to working is definitely the key. the more we can involve people who are working around, particularly those young players, we talked about host families, etc., the families themselves, the better, because the education then spreads out. And all being well, through this process, the cultures will start to change. And even in societal areas, there'll be a better understanding and lowering of stigma for mental health so people can seek help early. Thank you very much.